Thyroid gland, remember it is located in the root of neck on either side of the trachea. So it consists of two lobes. One is right lobe and other is the left lobe. The right and left lobe, they are connected by the thin strip. This strip is known as isthmus. In adult, the weight is, remember, 20 to 40 grams, and it is the thyroid, it is larger in the females than in males. Remember that. The structure and functional of thyroid can change in different stages of menstrual cycle in the females. Uh, its activity increases during pregnancy and lactation and it decreases during the menopause. So it is larger in the females than the males. The thyroid gland, it is made up of large number of spherical structures that are known as follicles. So these follicles are the functional unit of gland. Each follicle, it is lined by the cuboidal epithelium cells that is known as follicular cells. So inside the follicle there is gel-like substance that is known as the colloid. So that is made up of mainly of thyroglobulin. That is a precursor to the thyroid hormone. Now the follicular cells, they secrete main two thyroid hormone. They are the T4 hormone and T3 hormone. The remember that 90% of the thyroid secretion is T4 and T3 consists of 9 to 10%. The T3, it is secreted in small quantity and it is more potent and biological active than the T4. In addition to the follicular cells, the thyroid gland contains parafollicular cells that are known as C cells that are located between the follicles. So they secrete the hormone calcitonin. Remember, T4 and T3 hormone, they are essential for regulating metabolism. They control the rate at which body uses energy, affecting almost every tissue in the body. These hormones influence the heart rate, temperature, and the growth. So they play a role in brain development and function, especially in the infants and children. Thyroid hormone also involves in maintaining the bone density, brain development. So calcitonin, it is primarily involved in calcium and bone metabolism. It helps to lower the blood calcium level by inhibiting the osteoclast activity that prevents the breakdown of bones and promote calcium deposition in the bones. Now synthesis of thyroid hormone. The synthesis of thyroid hormone, the remembered iodine and tyrosine, they are essential required components for the synthesis of thyroid hormone. Iodine is absorbed from the diet and it is converted into iodide in the GIT tract, while thyroxine, it is obtained from the dietary source. For the synthesis of thyroid hormone in normal quantity, 1 milligram of iodine is required per week. The stages of thyroid hormone. occurs in the five stages. The first is the thyroglobulin synthesis. Thyroglobulin, it is a large glycoprotein that is synthesized in ER endoplasmic reticulum of the and Golgi apparatus of the follicular cells in the thyroid gland. After synthesis thyroglobulin, it is stored in follicular cells of thyroid gland. The second step is iodide trapping. The iodide ions are transported from the bloodstream into the follicular cells against the electrochemical gradient. That is the process we know. We called it as iodide trapping. The transport of iodide occurs via the sodium iodide symport pump. Third step is transport of iodide into the follicular cells. The oxidized iodide is then transported into the follicular cells that is ready to be incorporated into thyroglobulin. The next step is iodination and the coupling reaction. Iodinization involves the binding of iodine to tyrosine residue, forming monoiodide tyrosine or diiodine tyrosine. So these tyrosine undergo coupling reaction. That is monoiodide. It combines with the diiodide to form T3 and diiodide. It combines to form T4. So remember T4 it is produced in greater quantity compared to T3. A small amount of reverse T3 is also produced that is biological inactive. So after the synthesis the thyroid hormone, the thyroxine, T4 and T3 remain stored within the thyroid gland in a unique form. So these hormones are stored in the form of vesicles within the thyroglobulin molecule inside the follicular lumen of the thyroid gland. Coming to the transport of the thyroid hormone in the blood, the thyroid hormone, particularly T4 and T3, they are transported in blood by three types of protein. First is the thyroxine binding globulin, second is transerythrin, and third is the albumin. Thyroxine binding globulin, it has high affinity for thyroxine and one third of the thyroid hormone in the bloodstream is bound to this protein. Second is transerythrin. Transerythrin transport about one fourth of the thyroid hormone in the blood. The third is the albumin protein. It is the major plasma protein that transport about one tenth of the thyroid hormone. Now let us discuss the function of the thyroid hormone. First is that it increases the basal metabolic rate. Thyroid hormone, thyroxine that is T4 increases the metabolic activity in most body tissue except for the brain, retina, spleen, testes and the lungs. So it increases the BMR. How it increases the BMR? By increasing the concentration oxygen consumption of the tissues. So that process is known as calorigenic action. Second is action on proteins. How does it affect proteins? Thyroid hormone increases the synthesis of protein in cell. How does it accelerate? This process is accelerated by mechanism. The first is the increasing the translation of the RNA. What thyroid hormone do is it enhances the RNA translation in the cells, activating ribosomes leading to increased protein synthesis. Second is thyroid hormone acts on the mitochondria and so increases their number and activity in most cells. So this enhances the synthesis of RNA and other substance by activating series of enzymes that boost up the ATP production. Apart from that, it increases the activity of cellular enzymes. Now let us discuss the action of thyroxine on metabolism and physiological system. Thyroxine, thyroid hormone, has a broad action on various metabolic process and physiological system in the body. Third is action on the carbohydrate metabolism. It stimulates almost all processes involved in metabolism of carbohydrate. So first of all, it increases the absorption of glucose from GIT tract. Second, it enhances the glucose uptake by the cell, accelerating the glucose transport through the cell membrane. Third, it increases the breakdown of glycogen into glucose. The process we call it as glycogenolysis. The fourth is it accelerates the gluconeogenesis, that is the formation of glucose from non-carbohydrate sources. What is the thyroxine effect on the fat metabolism? It decreases the fat storage by mobilizing it from adipose tissue and fat deposit. So the mobilized fat is converted into free fatty acid. So that is then transported by the blood. So it increases the free fatty acid level in the blood. What is the action on the plasma and liver fats? It increases the free fatty acid level in the blood. Thyroxine specifically decreases the cholesterol, phospholipid, and triglyceride in the plasma. Sixth is action on the vitamin metabolism. It increases the formation of various enzymes. So vitamins, we know that they are component of enzymes. They are utilized in a greater amount that lead to vitamin deficiency during hypersecretion of the thyroxine. What is the action on the body temperature? So thyroid hormone, what it does is it increases the heat production in the body. How it increases the heat production? By accelerating the cellular metabolic process and increasing the BMR. Action on growth. It has both general and specific effect on growth. Increased thyroid secretion accelerate the body growth, especially in the children. The lack of thyroxine arrests the growth, and it also causes early closure of epiphysis, which may result in shorter stature in hypothyroidism. Ninth is action on body weight. Thyroxine is essential for maintaining the body weight. Increased thyroxine secretion decreases the body weight and the fat storage. What is it? Action on the blood? It stimulates the erythropoietic activity, and hence it increases the blood volume, making it an important factor in erythropoiesis. What is the action on the cardiovascular system? Thyroxine enhances the overall activity of the cardiovascular system. First of all, it increases the heart rate, that is the key indicator in diagnosing hypothyroidism and hyperthyroidism. It increases the force of contraction. The heart may weaken due to the excess activity and protein catabolism that lead to procardiac decompensation. What is the action on the blood vessel? It causes vasodilation. On the arterial blood pressure, it increases systolic and it decreases the diastolic pressure. So that causes an increase in the pulse pressure without altering the mean arterial pressure. What is the action on the respiration? Thyroxine indirectly increases the rate and force of respiration. So the increased metabolic rate that is caused by thyroxine increases the oxygen demand and carbon dioxide formation, stimulating the respiratory center to increase the respiratory activity. Apart from that, thyroxine increases the appetite, food intake, GIT secretions and movements. The hyposecretion of thyroxine results in diarrhea, while the hypersecretion results in diarrhea, while the hyposecretion leads to the constipation. Effect on the central nervous system, it is essential for development and maintenance of normal CNS function. Action on the sleep, normal thyroxine hormone, they are required for regular sleep patterns. Hypersecretion causes overstimulation. Action on sexual activity, levels are important for normal sexual activity in men. Hypothyroidism can cause loss of libido, while the hypersecretion can lead to impotency. The factors that decrease the secretion of thyroid hormone. The first is excess iodide intake. Second is stress. Third, somatostatin. Fourth, glucocorticoids. Fifth, dopamine. So remember, these all decreases the secretion of the thyroid hormone. Now, what are the disorders of thyroid gland? You should know. The first is hyperthyroidism. Hyper means increase in the secretion of the thyroid hormone. The causes are Graves' disease. What is Graves' disease? It is an autoimmune disease where the thyroid stimulating auto antibodies act like thyroid stimulating hormone that lead to hypersecretion of the thyroid hormone. The second could be thyroid adenoma. It is a localized tumor in the thyroid tissue that secretes large amount of thyroid hormone. Coming to the sign and symptoms, what are the sign and symptoms? There is increased tolerance to the heat, increased sweating, weight loss, diarrhea, muscle weakness, nervousness, fatigue, inability to sleep, mild tremors, toxic goiter, oligomenoria, exophthalmos. Exophthalmos means the patient has a protrusion of a eyeball, polycythemia, tachycardia, systemic hypertension, and cardiac failure. Exophthalmos can lead to blindness due to optic nerve damage or corneal ulceration. Other is hypothyroidism. When there is decrease in the secretion of the thyroid hormone, we name it as hypothyroidism. What are the forms? They could be myxedema, that is seen in adults, characterized by generalized edematous appearance and is often caused by Hashimoto-thyroiditis. Second is cretinism that occurs in children. Here we see stunted growth due to absence of the thyroid gland, genetic disorders, or iodine deficiency. Sign and symptoms of myxedema: there would be swelling of face, bagginess under the eye, non-pitting edema, atherosclerosis, anemia, fatigue, menorrhagia, and polynuria. There is weight gain here. Instead of weight loss, there is weight gain, constipation, depressed hair growth, scaly skin, husky voice, and cold intolerance is seen. What are the signs and symptoms of cretinism? There is sluggish movement, croaking cry, stunted growth, and large tongue. What is difference between cretinism and dwarfism? Cretinism, remember, it involves a mental retardation and disproportionate body growth, while the pituitary dwarfism has normal intelligence and proportionate growth. Goiter. What is goiter? Goiter is enlargement of the thyroid gland. What are its type? It can be either toxic goiter that is associated with hyperthyroidism, or it could be non-toxic goiter that is associated with hypothyroidism. We classify non-toxic goiter into endemic colloidal goiter or non-toxic goiter. Now coming to the treatment for the thyroid disorders, the first of all, there for the hyperthyroidism we can give is anti-thyroid substance like thiocyanates that inhibit iodide trapping. We can give propyl thiouracil or methimazole that blocks the thyroid hormone synthesis, or the surgical removal like thyroidectomy is performed. Hypothyroidism, when there is administration of thyroid or thyroxine tablet can be given. We can do is thyroid function test, that is measurement of plasma T3, T4 levels, measurement of TRH and TSH level, or measurement of basal metabolic rate.